Mosquitoes. These tiny, seemingly insignificant insects are often dismissed as mere annoyances, their high-pitched buzz a familiar sound in many parts of the world. But these tiny buzzing insects are more than just a nuisance. They are vectors of some of the most dangerous diseases known to humanity. Their bites can lead to itching and discomfort, but the real danger lies in what they carry within them. They are harbingers of disease, carrying within them the potential for widespread suffering. From the swamps and stagnant waters where they breed, they emerge as silent predators, capable of transmitting deadly pathogens with a single bite. While malaria and dengue often steal the headlines, another silent threat lurks in the shadows: Japanese encephalitis, or GE. This lesser-known but equally dangerous disease is a stark reminder of the hidden dangers that mosquitoes can bring. This viral infection, primarily found in Asia and the Western Pacific, can have devastating consequences, particularly for children and the elderly. The symptoms can range from mild fever to severe neurological damage, and in some cases, it can be fatal. It is a stark reminder that the smallest of creatures can pose the greatest of risks. The mosquito, with its delicate wings and slender proboscis, is a formidable adversary in the world of infectious diseases. Understanding GE, its transmission, and its impact is crucial in our fight against mosquito-borne diseases. Scientists around the world are working tirelessly to unravel the mysteries of this virus, studying the life cycle of mosquitoes and the ways in which they spread the disease. By arming ourselves with knowledge and taking proactive measures, we can protect ourselves and our communities from this silent threat. Simple actions like using mosquito nets, applying mosquito repellent, and participating in community spraying programs can make a significant difference in reducing the risk of GE and other mosquito-borne diseases. Education and awareness are key. By spreading information about the dangers of mosquito-borne diseases and the steps that can be taken to prevent them, we can empower individuals and communities to take action. Together, we can create a safer, healthier world, free from the silent threat that lurks in the shadows. Japanese encephalitis, or GE, is a viral infection that attacks the brain. It is a serious disease that can lead to inflammation of the brain, causing symptoms such as high fever, headache, neck stiffness, disorientation, and even seizures. In severe cases, it can result in permanent neurological damage or death. GE belongs to the same family of viruses as dengue, yellow fever, and West Nile virus, all of which are transmitted by mosquitoes. These viruses are part of the flavivirus genus, known for their ability to cause significant health issues in humans. The transmission cycle involves mosquitoes picking up the virus from infected animals and then passing it on to humans through their bites. While GE can infect anyone, it primarily affects those living in rural areas where rice paddies and pig farms provide ideal breeding grounds for mosquitoes. These environments are particularly conducive to the proliferation of the Culex mosquito, which is the primary vector for GE. People working in these fields or living nearby are at a higher risk of exposure. The virus spreads through the bite of an infected Culex mosquito, particularly Culex tritineurincus. This species is known for its ability to thrive in agricultural settings, where it can easily come into contact with both animals and humans. Once bitten, the virus enters the bloodstream and can travel to the brain, leading to the onset of symptoms. These mosquitoes thrive in warm climates and stagnant water, making certain regions more susceptible to outbreaks. Areas with monsoon seasons, tropical climates, and poor drainage systems are particularly vulnerable. Preventative measures, such as eliminating standing water and using mosquito nets, are crucial in reducing the risk of GE. Vaccination is also available and recommended for those living in or traveling to high-risk areas. The Japanese encephalitis (JE) virus has a complex and intricate life cycle that involves both mosquitoes and various animals. This cycle is essential for the virus's survival and propagation in nature. It typically circulates between infected mosquitoes and birds, often water birds like herons and egrets. These birds serve as natural reservoirs for the virus, meaning they harbor the virus without succumbing to the disease. When a mosquito bites an infected bird, it picks up the virus and can then transmit it to other birds or animals. Pigs play a crucial role in the amplification of the GE virus. They are considered amplifying hosts because they can develop high levels of the virus in their bloodstream. This makes them particularly effective at spreading the virus to mosquitoes that bite them. When a pig is bitten by an infected mosquito, it develops high levels of the virus in its blood. This high viral load makes pigs prime targets for further mosquito transmission. Essentially, pigs act as a bridge, amplifying the virus and facilitating its spread to other mosquitoes. Humans, however, are considered dead-end hosts for the GE virus. This means that while a mosquito can transmit the virus from an infected pig to a human, the virus does not reach levels in the human bloodstream that are high enough to infect another mosquito. Therefore, humans do not contribute to the further spread of the virus. This means that while a mosquito can transmit the virus from an infected pig to a human, it cannot be passed from one human to another. The transmission cycle is interrupted at the human stage, making it a dead end for the virus. Understanding this complex transmission cycle is crucial for implementing effective control measures. Strategies such as mosquito control, which includes spraying insecticides and eliminating standing water where mosquitoes breed, are vital. Additionally, vaccination programs for humans and pigs can significantly reduce the incidence of GE by targeting both the mosquito population and the amplifying hosts. We can break the transmission cycle and protect vulnerable populations from this potentially deadly virus. The majority of people infected with GE experience no symptoms or only mild flu-like illness. They may have fever, headache, muscle aches, and fatigue. However, for a small percentage, the virus can penetrate the brain, leading to severe encephalitis. Symptoms of encephalitis include high fever, stiff neck, disorientation, seizures, paralysis, and coma. The progression from mild symptoms to severe encephalitis can be rapid, highlighting the need for immediate medical attention if any GE symptoms are observed. Severe encephalitis caused by GE can leave lasting damage. Even with treatment, approximately 20 to 30% of those with severe encephalitis die. Those who survive often face long-term neurological complications. These can include cognitive impairment, memory loss, learning difficulties, epilepsy, and paralysis. The burden of these long-term effects underscores the importance of prevention and early intervention. While anyone can contract GE, certain groups are at higher risk. Children under the age of 15 are particularly vulnerable, as their immune systems are still developing. People who live or work in rural areas where the virus is prevalent, such as farmers and agricultural workers, are also at increased risk. Travelers to endemic areas, especially those engaging in outdoor activities, should take necessary precautions. The most effective way to prevent GE is to avoid mosquito bites. This can be achieved through a combination of personal protective measures and environmental control. Wearing long-sleeved clothing and pants, using mosquito repellents containing DEET or picaridin, and sleeping under bed nets are crucial steps. Eliminating mosquito breeding sites is equally important. This includes removing stagnant water from containers around homes, clearing clogged drains, and properly managing rice fields and irrigation systems. Vaccination is a powerful tool in the fight against GE. Several safe and effective vaccines are available, providing long-lasting protection against the virus. Vaccination is particularly important for people living in or traveling to areas where GE is endemic. It is also recommended for those whose occupations or activities put them at increased risk of infection. There is no specific antiviral treatment for GE yet. Treatment focuses on managing symptoms and providing supportive care. This includes hospitalization, intravenous fluids, medication to reduce brain swelling, and respiratory support. Rehabilitation, including physical, occupational, and speech therapy, plays a crucial role in recovery, especially for those with long-term neurological complications. The fight against Japanese encephalitis is a collective effort. By staying informed about the disease, its transmission, and prevention strategies, we can all contribute to reducing its impact. Being aware of the risks, taking necessary precautions, and getting vaccinated are crucial steps in protecting ourselves and our communities. Vigilance, preparedness, and community engagement are our best defenses against this silent threat.